Hi, we are studying psychological disorders. You should have in front of you your anxiety disorder video notes. They look like this. There's 2 pages, and we're starting here at the top. Our state standard is students will explore the common characteristics of abnormal behavior as well as the influence culture has had on that definition. Students also identify major theories and categories of abnormal behavior. Students discuss characteristics of effective treatment and prevention of abnormal behaviors. You've already done some of this stuff. When it comes to identifying categories of abnormal behavior, you have a list of vocabulary from Quizlet that was titled Categories of Disorders. So that's really where we're covering this. It's groups of specific disorders, kind of like an umbrella with other disorders underneath that. We'll focus on anxiety disorders today. You've also taken a look at some of the major theories. When we studied the brain, the nervous system, neurotransmitters, and the endocrine system or hormones, that helped us understand some of the reasons why people might have a psychological disorder. We'll talk about culture. We'll also talk about prevention. I think that might be one of the more important things. So let's take a look at your notes and look at the first question that I ask. So here's our standard here. But my question is, why might a person be diagnosed with a psychological disorder and not just considered different, abnormal, eccentric, or odd? When you're taking notes, I'd like you to be taking notes on paper so that you can use these on a test. My tests are locked, so you need a paper copy of your notes. So let's answer that question. What's the difference between having a psychological disorder and just being kind of odd or different? Psychological disorders happen when a person's thoughts and behaviors interfere with their ability to cope with everyday life. You're not doing the things that you need to do. You don't feel like you can go to school or go to work, take care of yourself, take care of the people around you when that's your responsibility. Um, and that's when we start to think about diagnosing a person with a psychological disorder. Remember that anytime during the video, if I'm talking too fast, you can always pause and write down your notes. So when should a person seek help? Even if they don't have a psychological disorder, if some of these things are happening that are on this screen here, are occurring, you might need some help. And it doesn't mean you have a psychological disorder. You might just be going through a rough patch in life, not sure how to solve your problems. I would write down the things that are highlighted in yellow there. So maladaptive and dysfunctional, those are both vocabulary words under our symptoms vocabulary. So maladaptive, when you're doing things that are bad for you, certainly this is bad for you. Abusing yourself is bad for you. And so that's what we mean by that. Using drugs, alcohol, self-harm, when things are dysfunctional, when you're doing the opposite of what you're supposed to be doing. So you're supposed to be in school, but you're cutting school, you're staying home, you're getting high. Those kinds of things would be considered dysfunctional behaviors. Shouldn't say you, could be anybody. If you're a parent and you're not taking care of your children, if you're a child and you're abusing your parent, if you're in a relationship and making that person that you have coupled with feel less than themselves, I mean, you're demeaning them, you're abusing them, that's dysfunctional. That's not what a relationship should be. If you feel like you're abnormal or in a way that makes you distressful and makes me feel bad, um, that would be when you might want to seek help and wonder why you're feeling this distress, why you're feeling bad inside, why you feel like you're suffering. That's something that you need to talk to somebody about. If it lasts for, you know, too long, I'd say at least a couple of weeks or so, you might want to talk to somebody and see if we can get that taken care of. Or if you know somebody in that way, maybe lead them towards help. And then certainly if behavior is getting you into trouble, and that's what we mean by deviant or socially unacceptable behavior. Oftentimes that means breaking the law or breaking the rules, breaking those expectations that are going to get you in trouble, get a person suspended, get a person incarcerated, get fines, get kicked out of the house, lose your relationships, lose your property. Those would be deviant and socially unacceptable. All of these are deviant and socially unacceptable. This is an example of the consequence of being deviant or doing something that's socially unacceptable. Certainly, these guys walking naked in the street, that's against the law. Um, So those are kind of heads up of maybe we need to get help for people. And our society is not very good at this yet. This is something you study in sociology, particularly. How do we help people that are in these situations? And that's something that we need to get better at. I have a student, I just saw him at the election the other day. He graduated. He was a psychology student, and he's working in the criminal justice system with juveniles, and he is working in programs other than incarcerating juveniles to stop maladaptive and dysfunctional behaviors or deviant and socially unacceptable behaviors. And he said he loves his job. Your next question is, what's the DSM-5? DSM-5, this one right here. D stands for diagnostic, S stands for statistical, M stands for manual, and this V is Roman numeral 5. And it is a book that psychologists and psychiatrists use to diagnose people. It has lists of symptoms. It organizes things into different disorders. And they use that to diagnose people. So they listen to your symptoms. They listen to your history. They hear how often these things happen to you, how long they've been happening to you. And that's what they use to diagnose people. DSM-5. There's been lots of different manuals. It changes over time, and culture can definitely change this. For example, like DSM-3 and previous ones before that had homosexuality in there as a psychological disorder, because back in the day, homosexuality was illegal. And so that was considered deviant. Times have changed. And so, hang on. All right. Anyways, DSM-3 changed with the times, and homosexuality is no longer illegal, no longer considered deviant by most of society, and so it's no longer considered a psychological disorder. Another example would be being transgender. That was in DSM-4, but it's no longer in the book anymore, because it's not illegal, it's not considered deviant, and unless it's distressful to the person, it wouldn't be considered a disorder. If it's distressful, it's called gender dysphoria, and then it's categorized in the DSM. And most recently in the DSM-5, autism has been kind of, I don't want to say reclassified, but the description of it has changed. Wait a minute. All right. Anxiety disorder. So you don't have to write down anything on this slide. You have this definition in your categories of disorders vocabulary from Quizlet, but I'll just review with you. So when a person feels a state of dread, it means they have to do something they don't want to do. Okay, they're supposed to do something they don't want to do. They feel obligated to do it and they don't want to do it. For example, I dread going to funerals. I can go. I don't have a disorder. I don't shake and tremble, but I don't like going. An anxiety disorder, a person would be so nervous and so upset about having to do something that they're physically getting ill. They're physically getting sick. They're shaking. And that caused by internal systems called the sympathetic and the autonomic nervous system that control things like our heart rate and our breathing and our digestive system and our blood pressure and digestion of food. That's all the automatic stuff that happens to us. It kind of goes into overdrive with people with anxiety disorders. We're going to go over these. In this video, we're just going to do panic disorder. So panic disorder is the most common reason why people go to see a psychologist. We want to describe some of the symptoms of it. So the scariest thing about a panic attack, and many of you know this because some of you have them or have seen people have them, nothing bad is happening in the moment. Nothing terrible. No one's dying. There's not an accident happening. Everything's just completely normal. But all of a sudden, a person takes on these terrible physical symptoms like the trembling, the hyperventilation, even chest pain, like you're having a heart attack. And sometimes they maybe even feel like they're going crazy because they feel like kind of losing touch with things. And they might feel like they're dying. They might call 911 and get an ambulance. I know people who have done that because they have the chest pain and the hyperventilating and they think they're having a heart attack when it's a panic attack. And so if you watch that video from e-learning, the young woman walks you through of what it's like when she's suffering from a panic attack and how it's just so distressful to her. There are treatments, and so we'll look at the treatments in a later video. I'm not going to show them to you right now, but I'll give you the links to the videos, and we will practice some of them in class. But I want you to know them in case you ever become overwhelmed with anxiety. But I also want you to know about those things so you can help others who might be experiencing a panic attack. You're not to make fun of a person who's having a panic attack. They might not even know they're having a panic attack. And so to be able to be the calming influence for a person is really important. It's one of the reasons why you're taking psychology. So there's two techniques that we'll learn about and you'll watch videos about. One of them is called grounding and another is called nostril breathing. And so we'll learn about those in separate videos. That's all for now.